Okay, today I wanted to do a little treatment on myself because I had a long week at work and I kind of noticed that I was having a lot of hypertension through my forearms, a little tingling in my hand every once in a while. Notice when I have a lot of repetitive stress here in the kind of carpal tunnel region, my hands get a little tingly. And so I thought I would use this opportunity to do some self care and use my fancy new rock tape tools. Not so much of a tutorial, but more of just some self care. Let you guys know how often I do this and things like that. So, I probably work on myself, I would say probably like 2 to 3 times a month. Particularly my forearms, and I have another therapist I work with that I trade with, and it's been super awesome. And it's really healthy for us to do that for each other. We don't charge each other anything. We just do some trades. I kind of start off with like the more kind of like not so sharp end, and I get real close to the origins here of the kind of extensor muscles here. I personally get a lot of tightness and stiffness to the kind of bicep region, so I'll kind of crush some of that later. But I just go back and forth until I feel like I've generated enough heat here. If you're a new therapist, figuring out like a self-care routine early on is going to be vital for your success. Whether that means stretching, getting massage, taking breaks, like appropriate breaks, is so important. I know money is important too, but trying to, find a healthy way to recover from your days and weeks, because sometimes it compounds. And for me, I work on myself maybe 2 to 3 times a month, and I get massage about once a month. Now, I only work about 3 days a week. I do 5 to 6 sessions a day, and that fifth and sixth one varies because, accounts for cancellations, and sometimes I just feel like 5 is the perfect amount. So I do change my schedule a lot. I would say probably like once a year, I'll probably adjust my schedule depending on how I've been feeling, depending if I feel like I'm recovering. Now, I have 4 consecutive days off, which is remarkable for my mental health and also just my body. And of course, most massage therapists get paid per session, not per hour. So, it aligns with my lifestyle and aligns with the bills I have to pay and things like that. So, that's something to keep in mind. You see how pink that's getting? That is great. We really like that. I'm kind of just moving down like 1 inch at a time. I'll do some broad strokes later, but right around this region it starts to kind of get bony. So I kind of stop right around this kind of area, but I just move slowly, if I feel some sticky, if I feel like a trigger point or some adhesions, which I have a lot of here, especially in the extensors of the forearm, I kind of stop and feel them with my hands, and kind of feels like little road bumps, kind of like those speed bumps at Target. There's so many of them. But anyways, that's super, super important. Another thing that I think is worth mentioning is, I work out pretty frequently. And I've noticed that during my work week, I cannot really work on doing any pulling patterns at the gym, like seated rows or overhead pull downs, pull ups, bent over rows, things like that, because my grip is just shot. I've tried working out before my shifts, and my hands kind of start off gassed personally. And I've tried working out after work, with some pulling patterns, and it still sucks. Like, I noticed that my hands fatigue before my back does, and that kind of sucks, but it is what it is. And so during the week, during my Tuesday through Thursday schedule, I typically just work on cardio and pushing patterns. Things like triceps and chest press and things like that. But those are some kind of like small adjustments I had to make to my life just because I do this for work. One of the biggest mistakes I think, new therapists make is they bite more than what they can chew, and their body really, really takes a toll. And, the average lifespan of a therapist is pretty low. Don't quote me on this, but I'm certain it's like between 1 to 3 years. I think this is really hard on your body. And if you don't take care of yourself, if you don't pay attention to your body, you're not going to do well. I have a therapist that I work with who's been massaging for 40 years. And, anytime I'm having some kind of general just trouble, with my body or, struggling with, patient load or anything like that, I go talk to her. And, the best piece of advice that she's given me is, hey, be comfortable with changing your schedule. Be comfortable with doing less. And when you feel well, resume. And that's okay. There's nothing wrong with that. Make some small lifestyle changes so your finances don't take such a big hit. But she's like, that's what's allowed me to do it for so long. When I first started off, she said she was doing 8 massages a day, and now she only does 4 a day, right? And throughout her life, she says she's always adjusted it depending on how her body is feeling. And, as she's grown more mature in her career, she's like, I've noticed that sometimes like I have to do less just because, my body can't recover as well. Look at that. Nice and pink. That's beautiful. I like that. A little stretch. Okay, let's crush some of these supinators here and some of the forearm flexors. These don't feel as tight on me. I kind of struggle a little bit more with the extensors, but let's try this one here. I like this one because it's got little sharp edges here, and I can get real close to the little condyle right there, get real close to the origin. Just go back and forth here. Pivot with this. Oh, dang, that's tight. I remember when I first started doing massage, I must have been like 2 weeks in, and I just remember like regretting going to massage school because my body hurt so freaking bad. My back, my neck, my hands, my forearms, and it was crippling. But it just takes a little time for your body to adjust. I think when I first started massaging, which was about 7 years ago now, I was doing 5 massages 5 days a week. And that's pretty good. That's pretty good. And I sustained that for years. And I sustained that for a few years. And then as my life kind of started happening, and at the time my wife was in college, and we started to make a little bit more money, and I started to reduce my hours, and that was really nice. And I didn't realize how much pain I was working through just because I had to. And that was a really good example of what my friend suggested. But at the time I didn't even know I was doing that. I was just kind of like working through because of just the time in my life. And so really quick, this one is a little bit lighter, and I kind of feel like I have to like push a lot more. So I'm gonna actually go back to this one. Use this little sharper edge over here. This one's a lot heavier, so I kind of feel like the weight of the instrument itself does more of the work. But anyways, so it took a while for me to reduce. Let me see. I've tried working every other day. I've done 2 on, 1 off, 2 on. I've done 3 in a row, 5 in a row. I kind of feel like you need to find what works for you and your finances, and that's for you to find out. I would say it probably took me like, I don't know, a year to really let my body adapt and recover from the work. Wow, look at that. That's nice. A little bit of bruising there. That's cool. I like that. I'm gonna work into the bicep a bit here. But long story short, it takes a while, and that's all right. I think that whatever type of massage you specialize in is how your body is going to recover from it. Like, I do a lot of deep tissue, kind of sports massage, a lot of trigger point stuff. That was kind of what I was initially interested in because I've had a number of injuries and I've had a lot of really wonderful therapists before I was a therapist that really motivated me to become a therapist. And so I kind of knew right off the back that I wanted to do deep work. I wanted to do sports massage. I wanted to do clinical work. So I've only ever worked for clinics, and it's been very, very rewarding. But I don't know where I was going with this story. Oh yeah. So I noticed that for me, just by design, I feel like it's a little easier for my body to do deeper work. I don't know why. Like anytime I do a lot of like Swedish or repetitive work, it just destroys my hand. There's something about small movements, just repetitive, like a ton of petrissage or a ton of thumb circles, just burn my hands out so much. But when I kind of like need really strong and whole tissue and push really hard, it seems a lot easier for me. And maybe because I'm using my body or my body mechanics are decent, but I don't know. I've always had a little bit more of a firmer touch. I would say that's probably one of my biggest complaints from my patients is that I'm too rough. But you know what? At this point in my career, I mostly work on people that like what I offer. I don't have to adjust that often. I think that I'm far enough along that I have a lot of returning clients who like exactly what I do, or typically just pass the torch and say like, do whatever you want. Look at that. Look at all that heat we generated. Bicep feels good. Everything feels nice and loose. Really, really, really hot. One thing I like to do as well, right along the kind of like tendinous area of the forearm, right in the kind of carpal tunnel region. I kind of take like a little microscopic approach and just kind of work lightly through this area. I don't go very hard. Just go back and forth. I mean, there are some muscles in here, but they're kind of deeper to the tendons that are superficial. I sometimes feel like a little credit card or something like that would be pretty decent at this. But it's all right. I noticed that like some of my tendons here are kind of tender. Long week. Kind of go vertical here a little bit so I can kind of get in between some of those tendons. Oh, that's yummy. Here we are. Nothing crazy. Most of my tension is kind of up here anyways, but just to make some little extra room. Kind of spreading the palm here, opening the carpal tunnel, and just kind of strumming it left and right. I usually do this on the couch, watching TV. It's a really good way to do some self-care and watch some trash TV. It's a great way to wind down. I'll tell you what, I don't have any drama in my life, and I like watching other people's problems. I kind of feel like in massage therapy, that second part, the therapy part, unqualified AF, but we typically have a lot of really sensitive conversations, and unqualified, I don't ever give any advice other than like just some essential basic human qualities, like, hey, maybe we should listen more, or maybe we should be more compassionate or understanding, or things like that. But when I come home, I'm gonna tell you what, I'm tired. not physically tired, but like emotionally tired. And sometimes just watching some trash TV helps me just, it reminds me that, my life ain't that bad. Let me tell you what. I think it's pretty goofy. I do notice more pressure and just hypertension on my right arm. It's my preferred arm. And so like I tend to use this a lot more just in daily tasks, like, drinking coffee, turning the screwdriver, opening things, flipping, whatever, So I think just, daily overuse. And then on top of that, just doing massage, I noticed that like, oh man, a lot of stiffness through here, goes all the way up into the kind of arm here and the kind of origin of the muscle there, and it's all right. I think everyone has their own struggles. I'm lucky that I don't really get any back pain, any major neck pain. Sure, I get some neck stiffness, but it's not a big deal. I don't think about it that often. But I think my forearms are the things that I struggle with the most, which I'm kind of lucky because I can just work on myself. And that's pretty cool. I'm a big fan of that. See, this side's reacting a lot quicker. I'm not really doing more pressure, but immediately got red. Immediately kind of started bruising lightly there. Oh, dang. Feels pretty rough in there. I ain't gonna lie to you guys. But it is what it is. I don't know if you can hear it, can you? Feels pretty wild in there. It almost feels like grains of sand. Like when I try to explain to patients what like adhesions feel like, it's like little grains of sand just caught in the fibers of the fascia. Oh, that's nice. Already feels better. If you've never done scraping before, Graston, or what's another name? It's like, tool massage. I don't know, man. There's like 3 or 5 kind of interchangeable names for this type of modality. You should really consider it. It really saves your hands. And it brings so much heat to the area. Doing this before any kind of trigger point work, or doing this before any deep tissue, goddamn, it's yummy. And I think that I was a little late to the game. Just kind of got these a few weeks back, and I have been loving it. And these are, I would say, the more premium version of these. And I traded a patient of mine for these tools for some sessions. So we're able to barter for that exchange, and very thankful to them for that. Oh, feels pretty rough right here. Switch a little sharper edge. Ay, caramba. Dang, that's rough, dude. Oh, I ain't even gonna lie. But my coworker just bought a set from Amazon, and he said that he bought some super cheap ones, and they kind of seem to work just fine as well. But I think he's been using them for a few weeks now, and some of the reviews on Amazon were suggesting that it looks like they're stainless steel, but they're not, and they rust pretty quickly. So if you don't dry them completely, That kind of sucks. And so that's something to kind of keep in mind. No resting on these. Whoa, look, a little bruising there. See, that's yummy. I'm gonna work into the bicep here. Add a little bit more. Oh, can you hear that? Oh, yeah, nice. Oh my God. That's wild. I hope you can hear it. Oh, dang. There we are. That's delicious. Big fan of that. Really tender in there. Really tender in there. Oh, just kind of doing some stripping a little bit here just because I think that I got some real deep trigger points in there. Ay, caramba. Oh, that feels so good. Hurts like hell, but feels good. You can almost see where the bicep kind of splits right here. I wonder if I can fit the tool in there. I bet you I can. Let me grab this sucker. Oh, dang. Oh, dang, man. Maybe do it like that. Yeah. Oh, that's nice. Oh, that's intense, though. Holy smokes. Whew. I've never actually kind of used these little rivets here. Let's see what they have to offer. A little awkward. I don't even know how to hold it. Ah, yeah, like that. Okay. Okay, I see. Oh my God. Baby, let me love you now. There's so many ways to love you. Ah, oh, dang, that's crazy. Okay, that's enough. I feel like my forearm got put into a blender. So let's work down a little bit into these little tendons. No, I don't really have any sensitivity like I had on the left side. Use a smaller one. A lot more delicate in these areas. This little curvature kind of fits nice right there. Here we are. Oh, this is real good. Hope you guys learned something. I think that take care of yourself. Really, really important. Adapt your schedule to what your needs are. If you can't adjust your schedule, try to spend less. It's usually something that I try to do, like fluctuate between 5 and 6 massages. And I think that it's really important for you to make adjustments depending on where you are in your life. And if that means less V-Bucks on Fortnite, that's so be it. Anyways, love you guys. Peace out and adios.